Hashimoto's is something I treat really commonly in my clinic. And one thing to understand is that the definition of Hashimoto's is that it's an autoimmune thyroiditis. So you can have thyroid antibodies that are called thyroid peroxidase antibodies, or you can have what are called thyroglobulin antibodies. Some people have both, some people only have one or the other. I see a lot of people get treated with conventional medicine who either their doctor refuses to test them for thyroid antibodies, or if they do test them, they tell them there's nothing that they can do about it anyway. And sometimes I think they don't get tested for antibodies because the doctor doesn't have a treatment for it, so to them it doesn't really matter if they have antibodies. To me, it makes a huge difference because we do treat it differently in my clinic. And not only that, but a lot of people who have Hashimoto's can treat their autoimmune condition and get rid of their antibodies, which in essence means they don't have autoimmune thyroiditis anymore. And the reason that's important is because if you have an autoimmune thyroid condition, your body's attacking your thyroid gland, and eventually there's the potential that you'll just burn out your thyroid. And that's not a healthy place to be. The thyroid affects pretty much every body system. It's really important for bone health, emotional health, hormonal health, prevention of lots of other conditions indirectly like cardiovascular disease and even cancer. To me, it's a very big deal to treat autoimmune thyroid disease appropriately, and if not cure it, then at least make it less of an insult to the thyroid gland. Probably one of the biggest things that impacts Hashimoto's is exposure to gluten from wheat products and related grains. And the reason is, first and foremost, because gluten protein looks very much like thyroid tissue. And so if people are eating gluten, it stimulates their immune system to start attacking. And unfortunately, the body gets confused and also attacks the thyroid gland. The other thing that can happen is that gluten itself is very inflammatory, especially wheat that's grown in this part of the world because of use of pesticides, but it does affect how the grain genes proliferate and how they change. If you look at wheat that's grown in Europe and other parts of the world, it's a little bit less inflammatory because they don't use as much chemical pesticide in their agriculture. In any case, even wheat in Europe is somewhat inflammatory just because of the nature of the grain itself. And some people will argue that humans shouldn't actually be eating grain. I don't know that I would go that far, but in any case, wheat itself, especially in the United States, is very inflammatory and it causes a lot of leaky gut. So when your intestines become inflamed, the little tight junctions that should be close together kind of split apart and let food particles into the abdominal cavity, and that stimulates your body to attack because that's a foreign thing. And so just eating gluten itself causes a lot of potential other food reactions, because once your immune system starts attacking those food particles, you can develop sensitivity to them as well. Also, with that inflammation, it changes the gut bacterial balance. So in our gut, we have lots of healthy bacteria and sometimes we have pathogenic bacteria. And the balance between those two things is really important. And that's what people are talking about when they're talking about the microbiome of the gut. If you have a lot of inflammation for whatever reason, wheat being one of the big impacts to that, you can have a very disrupted bacterial balance. What happens sometimes too is that once you have that disrupted bacteria, it perpetuates inflammation. You can also start developing other autoimmune diseases. And it's important to realize that gluten not only looks like thyroid tissue, but in some areas of the body, it can look like nervous tissue. It can look like other tissues in the body, joint capsule tissue. And so some people actually have a lot of symptoms when they eat gluten. They get joint pain. Sometimes they get neuralgia or numbness and tingling or brain fog, things like that. And some people don't really have a reaction that they can associate with the gluten. If you have an autoimmune disease, or especially Hashimoto's, it's very important that you avoid gluten and gluten-related grains 100%. Sometimes people tell me they cannot feel a difference whether or not they eat gluten, but I can see it on their lab results. So a couple of times I've had someone avoid gluten for a period of time. We've tested their thyroid antibodies and then had them go and eat some gluten and retested their antibodies so that I can show them and they can have the experiential information to know that yes, it actually does make my antibodies higher. In some cases, a lot higher. And so if that happens, the higher your antibody levels are, the worse the attack on your gland is, and that's not an ideal situation.